Well, the White House is expected to make a formal recommendation soon, urging Americans in certain areas that they should be wearing masks. Well, that once again raises that debate of whether we all should be wearing masks when we go out in public for the places that we're going, like grocery stores. Well, joining me now with more on this is Dr. Matt Kotze, and he is the Vice President of Medical Affairs at CHI Memorial. Dr. Kotze, first of all, thank you so much for joining me on the live lines today. And let's get straight to it. The big question people around here are wondering is when we go out to the grocery store or somewhere like that, which is one of the few places that we can go, should we be wearing a mask?
So first of all, thank you for having me on the show today, Latrice. Really appreciate that chance to speak to the community. When we think about this disease, the coronavirus, it's really felt to be spread mainly by what we call contact and droplet methods. And what that means is that we're not spreading it by just breathing out, but we're spreading it out when we speak and there's a little bit of spit, or when we cough, just even if it's mild, then we're releasing these particles into the air and they settle on surfaces that someone else might touch and then infect themselves. So the concept of wearing masks is not so much to protect us from breathing in virus as it is to protect us, to keep us from spreading that virus when we do things like cough or sneeze. So I would not be surprised if there comes a recommendation that we should be wearing masks when we leave our homes to prevent that spread.
And one of the things that you stressed with me before the show we were talking about is because we're finding that more, as we learn more about this, that more people are asymptomatic, which means they don't display those typical symptoms that we put up on the screen for COVID-19. So therefore, if we have people walking around asymptomatic, don't know that they have it, it's really important that we are protecting others from this as well and taking those steps of prevention.
Absolutely. If you look at the statistics worldwide, about 95% of people with this virus have a very mild illness. And that mild illness could be no symptoms. It could be very simple symptoms that they feel are just their seasonal allergies. Either way, those people don't realize they're carrying the virus. So those are the people who are most likely to spread it.
Dr. Kotze, another thing a lot of people I think are bracing for is that the president and his task force said last week, and Governor Lee said this week, that we're preparing for a surge when it comes to cases. And, you know, I'm sure have heard those numbers too of the predictions. The question here in this area, are we prepared? The medical community, our hospitals, our medical professionals, do we have what we need if that surge hits?
We are preparing to the best of our abilities. We certainly have limited resources, but I know there are attempts going on now to expand those resources. The community has been preparing for several weeks. We at Memorial, and I know Erlanger and Parkridge have made the same plans and the same efforts to be as ready as we can be. And there are certainly significant changes that have been done. I do want to make a point, though, if I have a moment. When we talk about the surge and when we talk about the social distancing and the masks and the quarantining at home, the reason we're doing that is our hope, what we would love to see, is that the surge never comes. Now, we know something's coming. How much of it comes, we can't truly predict. But what we can predict is that if people stay at home, don't go outside unless it's absolutely necessary, if they social distance in all the ways we're recommending, we will significantly decrease this surge. And in doing that, we will significantly decrease the loss of life from this virus.
And that is what's so important. That's the ultimate goal for everyone. And just really quickly, what are those on the front lines at your hospital telling you? We know that they have been working tirelessly, long hours, and we've seen it's taken not only a physical but sometimes emotional toll as well on a lot of our medical professionals in dealing with this.
It is certainly emotionally draining, and I really want to say I am so proud of our staff and the staffs of the other hospitals. We have limited numbers of specialists with infectious disease, and we have leaned on them heavily. We have hospitalists who provide all the care of the patients in our facilities for the majority of patients, and they are working tirelessly. So we cannot thank those individuals enough, as well as our emergency room physicians and everyone involved on the front lines seeing these patients.
All right, Dr. Kotze, thank you so much for your time, and of course to Memorial, CHI Memorial, Erlanger, Park Ridge, all the hospitals and these medical professionals in our community. Thank you. And again, Dr. Kotze, thank you for joining me today.
Absolutely, and thank you so much, Latrice.